So overall in the phase 1 study, we actually enrolled 54 patients, and they were treated with escalating doses of Lorlatinib. And the main goal of the phase 1 was to establish safety and dosing, and to also see if there's some signs of anti-tumor activity. In the phase 1, we did establish that there was no maximum tolerated dose, but we did define a recommended phase 2 dose. That's the 100 milligram daily dose. And we also observed some very impressive clinical activity in ALK and ROS1 patients, including those who had failed multiple prior TKIs. And so this then led to the phase 2 portion of the study, where we actually had multiple different expansion cohorts. When we show the diagram, it looks very confusing, but it's pretty clear that these expansion cohorts are defined by whether or not patients were ALK or ROS1, and then within the ALK cohort, what treatments they had received prior to going on Lorlatinib. And so just to sort of summarize overall, what we saw is that Lorlatinib is very active in ALK-positive patients, including in those patients who have failed crizotinib or patients who have failed multiple ALK TKIs. In the crizotinib-resistant group, we saw a response rate of about 70% with Lorlatinib, so very active in the post-crizotinib setting. We did not yet have a median progression-free survival, but looks very active the way other second-generation inhibitors are active post-crizotinib. But what's unique with Lorlatinib is that we actually have data from the phase 2 showing that it also has activity in patients who have failed a second-generation inhibitor like ceritinib, alectinib, or brigatinib. And here the response rate was in the range of 35 to 40%, so a little bit lower than the post-crizotinib setting. But we did see really impressive intracranial responses, even after failure of prior brain-penetrable drugs. And median progression-free survival in these patients who had failed a second-generation inhibitor was in the range of about 5.5 to 7 months. So that's the overall sort of data, efficacy data that we observed in the phase 2 study.